Good afternoon, everyone. This is Dr. Ashish Atreja from Mount Sinai IBD Center. On behalf of Mount Sinai, I'd like to welcome you all to the Health Promise patient webinar. You may have seen my flickering image and video before. I tried my best so you can see the bow tie and me in a presentable way. But I think there's some issue with the video getting transmitted, so you'll have to bear without me on the video, but just I'll share the screens with you. It's our first patient webinar for Health Promise cohort, and we are extremely excited to have you here. And what we want to cover today is something very simple. We want to say what are the top 3 things that every patient with Crohn's or colitis need to be aware of so they can better take care of their disease and share that with their physician. I'm a practicing gastroenterologist, IBD physician here at Mount Sinai IBD Center. In fact, some of you are my patients. And most of this, we've been through this learning by being involved in the care that we feel that we need to go to a different level of engagement. So initially, we'll just talk about the 3 things we feel every patient should know. We'll talk about how Health Promise app can help in that. And then really what we want to focus on is a question-answer session. So we can hear how you are doing, how we can, in our IBD center, help you to feel optimally controlled with your disease, and if any additional features we need to bring into Health Promise app to help better care of you. So the main reason Health Promise came into being is because we all know there's a big gap between physicians' understanding and the patient's understanding of their disease. And we as physicians get a very limited view of your lives. 99.9% of your time is spent either at work or at your home. And only 1 or 2 visits, max 3 visits, we get a chance to see you in our clinic. And many times your symptoms may start at home. And sometimes I've seen patients, it gets too late by the time we get to know of the symptoms, and we cannot avoid the surgery. So one of our goals is to actually provide a very proactive care that we continuously know which patients are receiving the best practices, who are able to follow with their medications plan, and who are not, and which patients are having uncontrolled symptoms at any given time. Because then we can act proactively instead of waiting at the end of 3 months or 6 months. And if we look at our health system, we have around 7,000 patients with Crohn's or colitis. And really it's a tip of iceberg issue, because at the tip are the patients who are doing really very good, and they have a very good quality of life. They can do any sports activities they want. They can participate in any recreational activities they want. And really it's like not having a disease in that regard. But there are many more patients whom we never got a chance to ask their feedback. How are their symptoms doing on a day-to-day basis? Are they missing some social activities because of their IBD? Are they saving themselves not doing any sports activity they would have loved to do? Are they missing any school days and henceforth? And then there are some patients who see us once. They do not know when to follow up or how best to follow up, and we call them lost to follow up. So as we move towards a new standard of care, we want to take care of all the patients, and this is our philosophy of no patient getting left behind in terms of good quality care. When we started this journey around 3 years ago, we did a focus group of patients, and we asked the patients, tell us how is your IBD controlled, how well is your IBD? And what we found was 9 out of 15 patients, or 60%, wrongly estimated their IBD control. They thought they were better than what their symptoms objectively looked on a questionnaire. So if you look at this graph, the red vertical bars represent how patients perceive their quality of life, and the blue was actually what we measured. Many more patients thought they were good or fair. In fact, when we measured them through a questionnaire, which was validated, many more patients were in poor category and only having a fair control of symptoms. So that calls to the question that we need to have a very standardized toolkit to give to the patients so they can know firsthand whether they are really in control or not. That's the first question about symptoms that you should be asking yourself. The other thing we found from the focus group was there is a big doctor-patient communication divide. Because of limited time in the clinic, patients may not get, you guys may not get enough time to talk about all your symptoms. And those symptoms are so critical for us to learn and share from. So that led to the HealthPROMISE app, and we worked along this along with the patients. The goal was that we can track patients' health through this and provide the data to the physicians real time. So you're very familiar with this app, and our goal was to make the patient input of symptoms and quality metrics as a central part of this app. And every patient who touches Mount Sinai Health System eventually will receive a similar high quality care. We prescribe a quality improvement through this app, and we together work on how we can improve your quality, whether that's a quality of life or whether that's preventive health screening. So the top 3 things which I think I would like to have every patient remember, and we'll follow this up in a newsletter as well. The first and foremost is your symptoms, right? And the symptoms are very variable among patients. Some patients may feel more abdominal pain, some may feel more diarrhea, and some may have occasional bleeding. So we want to use a very validated questionnaire, 10 questions, which can actually guide you exactly how your symptoms are, give you a scorecard so you know you're in control or not. The second thing is many patients have symptoms under control, but their inflammation may not be controlled. And so once the symptoms are controlled, we want to see if the inflammation, whether that is the blood or the inflammation in endoscopy, that is controlled, because then once that is controlled, then your risk for future surgeries is much less. And the third thing is your preventive health screening, because you may have your symptoms controlled and your inflammation controlled, but many of patients are still at risk for having colon cancer. They may still be at risk for having a low bone density. So by preventive health screening, they can actually be may remain much more healthy even for long term. So let's talk about these 3 things. So your symptoms are the 10-item questionnaire which we see in HealthPROMISE is basically giving you a score. And the score 10 to 30 means you have very less symptoms and you're in good control. 31 to 50 means you have fair control, some symptoms, but 51 to 70 you are in poor control of symptoms, and that means we really need to change the medication treatment, and you really need to bring it to attention to your doctor. So these are symptoms, instead of you remembering, are already baked into the app. So as you track yourself every 2 weeks or more often, we get to know you're in control or not, and you get to know that as well. We're very happy to share that we've already started seeing patients improving their symptoms using the HealthPROMISE app. And this is a very interim analysis, but we've started seeing that patients are going from fair control of symptoms to good control of symptoms using the HealthPROMISE app. The second thing which I like to emphasize is inflammation. And here's an example of normal colon, and if we have a mucosal healing, this is how the colon looks like. But if people have inflammation, it becomes very red, fiery, ulcerated area. And this may not be obvious unless and until endoscopy is done or some blood markers are done. The blood markers include a sedimentation rate or a CRP. So if these levels are high, which you may be able to see in your MyChart app, then that shows that you have some kind of inflammation. Some physicians do test in stool, a level called as calprotectin, and if that is high, that can also tell if the inflammation is high. But the gold standard is during endoscopy, like the pictures we showed. And you should always be asking, if your symptoms are controlled, doctor, did I achieve mucosal healing? Because if you achieve mucosal healing, you're getting very close to having a normal colon or a normal small bowel. The third thing is preventive health screening. And these are a set of indicators that will continue to maintain you in good health. And you may have heard of that we don't want to use too much steroid treatment, and we want to get rid of that eventually. We also want you to have, for some of the patients who have colon affected, colon cancer surveillance every year or every 2 years. So these are all preventive health screening. You will not have any symptoms. You may have normal symptoms, but we still want to be sure that you are on top of these preventive health screening. The good thing is all these indicators are baked into the app, so it will actually track whether you are controlled or not in your preventive health screening. So if you see that you have some unmet intervention, then when you come to your doctor's visit, you can say that. Share the app and the report card with your doctor and tell them, I see that I have unmet interventions for this. Could you tell me so these can be met? The good thing is your physicians are already seeing your quality report. When you see them face-to-face, you can remind them that how your quality indicators are doing in preventive health screening and how your quality of life and symptoms are doing, so they can act on it and be proactive in changing the medications if they need to be changed, or ordering immunization if that has to be ordered. So we want to see patients and physicians partnering together with a common set of quality metrics, so that will allow us both to be staying proactive in managing your disease and health. So how are we hoping to close the quality gap? We are sending you newsletters every month, and that tells us what are the best care metrics and how you can use the app. We are sending you text messages, and we are started to do webinars such as this. We plan to do that monthly. We are bringing the next version of the app, which I'd like to demonstrate to you. And based on your feedback, we are providing an option to change the PIN to a password, which you can choose. It will automatically direct your call to your IBD center, and it will provide a verified health education content verified by your physicians to you, and will have a better notifications and an instant feedback button, so you can constantly help us improve the HealthPROMISE experience. While we are changing the computer to show you the version 1.5, can I please ask you to note these text messages and save that in your computer as a HealthPROMISE theme or HealthPROMISE? Because when you get from these, it should not look like they're coming from a stranger, but this is coming from your HealthPROMISE team. So if you don't mind just entering these numbers in your contact list in your smartphone and saving that as HealthPROMISE, that way these are our ways, and your physicians are communicating you through these text messages. And the other thing which I'd like to remind you is you can submit questions anytime. So we'll take the questions at the end of this demonstration, so we can have a very proactive question and answer session. I'm getting a question from Jennifer Baird that she does not have any sound. Okay, she got it? Okay, fair enough. So we are now showing you the 1.5, the new version of the app, to show the new changes and also get feedback from you. And we hope to release that in January. And this is Emma Muzo, who is our population health coordinator and physician extender. He's the one who is closely monitoring all the usage of the app and any symptoms, and forwards that to your physicians as well.
Okay. Hello, good evening everyone. We want to thank you for using the HealthPROMISE app, and we want to thank all those who have been sending us feedbacks on what we could do to make the app better for you to use. So just like Dr. Ashish has said, this is the 1.5 version, which is the new version of the HealthPROMISE app, and we have made some modifications. Now, if you could look at your screen, I'm going to log in. Then you select your center, which is Mount Sinai. Okay. Now, this is the physician dashboard. This is HealthPROMISE 1.5. Now, what we are going to do is just to walk you through, just 5 minutes. It's very easy to use, and it's similar to the old version that we had, but we just made some little modifications. Now, first of all, if you click on it, we created a profile. Now, what we can do with this is, with this profile, you can change your name, and just like Dr. Atreja has said, we have noticed that most patients forget their PIN, so we have made provision for you to be able to put the password you can remember to make it easy for you to use. Also, we have made it easy for you to put in your picture in your profile. So you could save a picture to it, just to make it more friendly. So going down, you can see the provision for a new password. You click on this, you put in whatever password you want to use, and then you click on update. You could also change your phone number, change your email, your first name, and your last name. Once you are done, you click on update, and that is that. Also, we have made some modification to the dashboard. And looking at this, it's similar to what we had before. We just made some few adjustments. Looking at the graph, just as we had in the old version, it shows you your quality of life score and the dates of which you have entered them. Now, clicking on the quality of life, it gives you the same questionnaire just as we had before, but in a different format. Now, in the previous version, we had the problems of people trying to drag it here and there, but with this version, what we did, we created a drop-down menu. And what that does is, if you read the question, you just need to click on the select button, and it gives you the list of all the options that are right here. You can see the bottom of my screen. You click on the option that applies to you, and you just click on done. So for each of the questions, instead of dragging it, you just click on please select on the drop-down menu, you click on the option, and then you click done. As soon as you're done with all the questions, you click on the submit button at the bottom of your screen. And it's as easy as that. Now, going back to the dashboard, Going back to the dashboard, we have the symptoms and we have the checklist of care. Now for the symptoms, it's similar to the same symptoms, it's the same thing. But what we did is, by dragging this from one side to the other, 1 being your best and 5 being your worst. If you look at the top, it says 2, it says 3. Now the higher the worse it goes, the red it becomes. Okay, making it very easy for you to use. You do this for all the symptoms. And then when you are done, you hit the submit button at the bottom of your screen, and that's it. Now, for the checklist of care. In a snapshot, looking at your app, you could see the checklist of care, those that are met, those that are not met, and those that you do not know. Now, by clicking on it, it gives you the list of the 15 variables that we are using. You click on each one, just like we do in the old app. You put the date.
And the reason for that, you filling that up, many of these quality metrics you are aware of because you may have got a flu shot from your primary care doctor and not from gastroenterologist. So many times you can fill this up, and that's what we encourage you. And that's why the IBD physician will learn from what you already have done.
Now also at the bottom of your screen, just like Dr. Atreja has pointed out, we have created a system where you could place a direct call to your IBD center. So you can see the bottom of your screen here, and by clicking on that link, it places a direct call directly to your IBD center. Now this is a new feature which was not in the old app. Okay, and then one more thing is the health education tab. You can see it. Now we created, it saves you the time of going to Mr. Google to search for things. Here we have drugs, we have IBD physicians that have come to record videos about what IBD is, the complications are, what to expect. So by clicking the health education button, it saves you the time of going to Google to search for things, and you can get all drugs or videos and all images of IBD on that tab. Now, another feature we have created on the left-hand side is your notification buttons. We have made it better. Now, if any notification is sent to you regarding the app, by the time you click on the notification, it gives you a list of all notifications that have come with the most recent on top. All you need to do is to click on the notification button, and it tells you what it wants to do. Now this notification is saying check your app. You click on this, and it automatically goes directly to what we are looking for. So this is a new feature we have added as well. And then we have the My Team button that gives you the option of putting in your primary care provider, putting in his details, his phone number, and his address. Now, the reason we did this is because once you have saved your primary physician, you can have a direct call access to the IBD center. You can have a direct call right from here. So these are the new features we have created in 1.5. We appreciate your feedback so that we try to make this better as we move along.
Thank you so much, Muzo. The other reason to fill a primary care doctor is we as IBD physician need to often communicate with you, either your surgeon or a psychiatrist or primary care doctor. And if you fill in these details, they come to us in our physician dashboard, and we can actually be much more proactive. And we can be much more proactive in communicating with your entire healthcare team. Give us 1 second as we just switch the computer. So now we are back into our screenshot. So the next steps will be, we'll follow this up with the Q&A session. We'll open up the speaker so you could speak and everyone can hear. I will recommend you can either do the Q&A by filling in the question answers in the panel, and we're already getting very good questions. I'll encourage you, any question you have, whether it's HealthPROMISE or in general about your care or future care, please put it here so we can answer them. You can also speak. My only recommendation will be just to keep privacy. Don't introduce yourself with your name, and then you will be opening everyone's mic in a moment. After this Q&A session, around 15 minutes, we want to be respectful of your time. We will be sending you a link to a survey, and then we want to involve you not only as a participant, but also as a patient partner. So it's really a whole village that is, in a way, that has come together to deliver this HealthPROMISE application. It started 3 years ago. We got grants from NIH, and we have 6 to 7 people team just supporting from the data side, from the application side, from the operational side, this whole HealthPROMISE implementation. And we're actively looking for patients who can also come as patients partners, which means we'll have them a teleconference call every 1 hour in a month, and twice a year we'll meet in person, so they become part of our IBD center to direct us what we should be doing for our patients in our IBD center and for HealthPROMISE. I'll encourage you to, the more feedback we get from you, the more it helps us evolve, and the more it helps us connect with you better. Thank you so much for being part of the team, and we'll open this webinar for Q&A session. Okay. So I'll give 30 seconds or so, and there's a few questions. I'll read them in a moment. But if someone has a question, please speak out or enter it. So all of you should be unmuted right now. So we've got one question, and it's a more of a comment, not specific to HealthPROMISE, but in care in general, that the biggest issue in Crohn's disease is communication, and some patients email the doctor, and they find that it's not easy to get into the doctor's office. That is the whole reason the HealthPROMISE came into being, because there's a big communication gap. We're trying to address that by 2 things. One is by staying proactive about your symptoms and preventive health. The doctor, even if you don't have a face-to-face visit, the doctor can see how well you are doing. The other thing is next year we are also bringing telemedicine to some of our patients, so which will mean that we can actually do a face-to-face chat over telemedicine, especially if they live very far away and cannot make in person. So if there is an appointment that is not getting done, I think through my chart or something, we want to hear from you so we can open up more slots if that is needed. But we do want to emphasize that there's a lot more aspects of self-care and collaborative care that can happen through platforms like HealthPROMISE and can potentially decrease the need of face-to-face visits or make the face-to-face visit much more action-oriented. So does that help in part answering your question? Yeah. Are there any other questions?
I have a question.
Please go ahead.
Hi. I seem to be having a problem calculating what stage I'm in. I seem to be fair, but I know that my symptoms are really not good, and I've had to call Dr. Sands, and by the way, he communicates fabulously with me.
Yes.
So I'm not, there's something I'm not doing correctly, and part of it, I think, is that there are no symptoms of blood or mucus. I'm so sorry to have to be so gross, but that's a big part of my problem when I start going downhill, vomiting. And so I don't know if that's part of it, but maybe you could help me out and guide me as to how I should be scoring this.
Right. So I think there are two aspects of the score. One is the score which gets based on the validated instrument called SIBDQ. But there are also symptoms, which are very specific, which I just showed. So not everyone, so fair for some people is okay because if they had surgeries, they may have diarrhea, they may just be fair. But for some patients, fair may not be best, and they can go to good. So I think that's a discussion between your doctor and you that these are my symptoms, I'm getting this score based on my prior surgeries or other aspects. Is this what I can achieve the maximum? Right? We know for sure if it is poor, then it is definitely something needs to be changed. Whether all patients who are in fair category need to be changed to good is a little subjective and up to the physician. For example, we have found sometimes the GI symptoms get better, but patients do suffer from anxiety and pain sometimes. And those sometimes do not even get better even after the right medication. That requires more holistic care. So your symptoms may come as fair not because of GI symptoms, but because of your quality of life, because of anxiety or other symptoms as well. So I think that's where the discussion entails. The physicians do have all the detailed breakdown of your dimensions. They can look into it, and at least our goal is to provide this information so it can be much more proactive conversation during your visit. And physicians already know what your symptoms are, rather than asking all those 20, 15 symptoms.
Right.
So,
well, what about adding the other symptoms? Is that something that you are looking into, or is there a reason you didn't add them?
So there are symptoms of, I'm going back to show, actually it's not shown here. If you go to the symptoms, like your HealthPROMISE app, there we can add blood and mucus to it. We can maintain that library, so that's a very good thing. We just, in the focus group we did, most of the patients who had blood and mucus started having other symptoms as well, so they were being captured. But I can totally see they may not be captured by other symptoms. So we can easily add them, and then you can track them using your symptoms.
Okay. And I think it's also a matter of being totally honest, as you showed us in the graph originally, exactly where we are, we tend to make ourselves look better. I think we push ourselves forward, and we really might be fair as opposed to good, or poor as opposed to fair. So it's a matter of adjusting and figuring out the system, the number system.
Thanks for sharing that. In fact, I'll share the story of one of my patients when I was in Cleveland Clinic. She came to me having 20 bowel movements a day for 15 years. And I looked at her and I said, why didn't you come earlier or approach? She said, because I have IBD, this is what I think I should expect, right? And so number one awareness we want to say is just because you have IBD does not mean you have a poor quality of life. In fact, the whole purpose of all the treatments is that you should be having as close to a normal quality of life as possible. So having this objective metrics of where your score is very key element of this discussion.
Thank you.
You're welcome. So the three things are, and I'm bringing them on the screen as well, is your symptoms, which we just talked about, your inflammation, right? So do all of you guys know whether you have active inflammation or not? You can just speak it out, all of us, and then I don't have a way where I can see you.
I don't know if we always know that we have active inflammation.
Right. So
I think that some people, just like the woman said, you get so used to a lower quality of life. Anything that's better, you're happy with.
Right.
And I don't think that doctors understand that. Like, not that we wish that you had what we had, but sometimes, like, I look good. I look normal. So when people see me, they're like, what do you mean you're sick?
right.
But I feel sick, and I'm tired, and you can't express that to somebody, but you don't want to look like crap every day.
Right. And
so you get dressed, and you go out and do all your stuff, but you're used to going to the bathroom.
Right. And
when you go 14 weeks, you feel good.
Right. That's very true. And in fact, I would share one of my patients who just has this very positive effect about him. And he's otherwise very healthy. And so he will never complain. And I can never know from him whether he's in control or not. I only get to know when he enters his symptoms and I get a score. I actually get to know that he's actually not doing good. And this came up in our focus groups as well. May I ask you, do you know what your score is?
I'm the young lady who's been having problems with her phone, so the app wasn't working. I just got a new phone last week, so I have to download the app again.
Okay, no problems. And then I'll be eager to say what your score is, and because we really want to see if you can use that in your day-to-day discussion when you go with your physician. So
right. Well, I had surgery about 7 months ago, and I think I started this. Maybe how long has this been going on?
So the next version that's happening is also will be available on the web. So even if your phone is not working or it's a flip phone, you can still access this on the World Wide Web.
Okay, perfect.
So part of the conversation is we have to work a two-pronged strategy. We want to bring it to all of you attention that it is not okay to suffer from symptoms. And this app allows you to actually share your symptom burden and your inflammation and preventive health with your physician. At the same time, we're doing something similar with every physician as well, that it's not just okay just to say, how are you doing, and then move on with the medication, but actually look at much more holistic symptoms through this app and the platform. So the discussion during face-to-face visit can be much more meaningful and patient-centered. And we really want you as patient partners to help even us physicians evolve, because this part was not trained to us in our medical school training. We never had instruments where patients can provide their symptoms using an app, right? So this is new form of care, and we all need to work together to bring this into our ecosystem.
I have another question. How would we know about our inflammation? One way would be the colonoscopy, if the doctor told us that it was inflamed, but also, as I understand it, when there's mucus it also, and bleeding, that means that there's inflammation too? Is there anything else that, another clue that we could have? Or?
That's correct. So one of the clues for you having inflammation is, if you have major inflammation, you will start having symptoms.
Mm-hmm.
So if you start having major symptoms, that's why then you may be thinking that you have inflammation.
Mm-hmm.
The other easy way, sometimes your symptoms are controlled and you may still be having inflammation. The way to pick up that inflammation is either endoscopy or the blood test, ESR-CRP. And if you recall, many times in your office visit, physicians will be asking you to do a blood test to check this inflammation level.
Mm-hmm.
So if you look at this ESR-CRP, these are normally shared with you, including in your MyChart app. So if you either look at the blood levels, rarely stool levels, or your endoscopy, and that will tell you whether you have inflammation or not. But if you have very bad symptoms, then most likely you have inflammation also.
Mm-hmm. Okay, thank you.
You're welcome. We are also going to a national conference next week called Advances, and where our purpose is to share with the rest of the researchers and clinicians nationally. And we're very happy to say we are 7 hospitals, including Johns Hopkins, who is leveraging this HealthPROMISE framework, so we can actually try to provide to as many IBD patients as possible. Can we ask you if there are any other questions? We're willing to be here. But if you could fill in the survey and also see if you can be patient partners where we can actually sit together in a round table and see how we can transform this care using this HealthPROMISE and make it better. So that will be wonderful to do it together. Right. So I'll give maybe, how should we give the survey to everyone here?
When the event closes, it'll automatically show up on their web browser.
Okay. So maybe I'll give 15, 20 more seconds to see if there are any questions. If not, we'll close the webinar, and at the closing of that, you will see a link to the survey.
Okay, thank you.
You're welcome.
I actually have a question, if you don't mind. I'm on audio only, so I haven't been able to see the slide you're showing. However, are you intending to maybe include like a food diary in the program, kind of way to track what you eat, so you can see like if you actually did happen to flare up?
Yeah,
you can see maybe like.
Yeah, that's a very good question, and that's a question we get asked often. So I think we are exploring that. Right now, we're not able to find any single food diary which narrows the exact foods in a very user-intuitive way that can help with tracking. There are other apps who do that. The challenge is we do not know what to make of the food intake. As a science, we have not found any kind of food really is pretty bad in triggering IBD flare. There are certain foods which people cannot tolerate if they are in flare. For example, if you are taking a high residue food like salads or something, that is very rough when you have active flare. If you have someone has a stricture, they cannot take high fiber diet because that leads to blockage. But is there any food which causes immediately flare of the IBD symptoms? We do not know. So part of our challenge is we didn't want to overburden our patients by having them expect that we as physicians want them to enter all this data. But what we can do is link to other apps. If people want to do that, they can do that using other apps. And if enough of you want to do that in HealthPROMISE, we can build that feature. So this is exactly the patient voice we want to hear back.
Okay. I think it would be great because if, I don't know if you're doing it yet, but it would be great to take that kind of data with you to a dietitian or to another doctor. You can get the more holistic view of it as opposed to just with your gastroenterologist.
Mm-hmm. Thanks for sharing that. Absolutely. So we'll put that into a feature request. The other question I have for all of you, you're getting our newsletter and text messages. Is that working for you?
Yes.
Okay. Our focus so far was mainly on recruitment, and MMOZO for the sole person. Now I think with most of the recruitment done, our focus now is patient engagement and patient empowerment. and also physician engagement and physician empowerment, right? So any other suggestions that you have on how we can engage with you better or in other ways? We plan to do this webinar every month. Is every month a good time, or we should be doing it every 2 weeks?
I think every month is good.
Okay.
I think every month is good.
Great. Thank you. And in the free comment section on the survey, you can also put any subjects of the webinar you want, any specific topics, for example, food or something you want us to discuss specifically in the forthcoming webinars. You direct us, and together we'll walk the path. How does that sound?
Great.
Great.
Good.
Right. Yeah. So we have recorded this webinar, and we'll share that in the newsletter, so people who have missed it or sometimes could not see everything can actually see the recording as well. And next time we also have one patient advocate, Laura Webb, who will be actually sharing her experience with you in the webinar. So it will be a joint webinar between a patient and a physician.
Great.
Really want to thank you so much for your participation, and we'll be ending this session, and we'll love to hear feedback from you in the survey that will be at the close end of the screen.
Thank you.
Thank you. Have a wonderful week ahead. Take care.
So, thanks.
Right.
Thank you.